Hey mama, I'm guessing you're here because your baby's got a rash and you're wondering, could it be hand, foot, and mouth? But most importantly, you're probably wondering, how do I help my little baby feel better? Well, in this video, I'll show you how to spot the signs of hand, foot, and mouth disease and how to support your little one naturally. Hi, I'm Genevieve Holland, the woman behind mamanatural.com, the #1 natural pregnancy and parenting brand. If you have a new baby, I've got a great free email series for you that tracks baby's developmental milestones and delivers simple, natural tips to help you and baby thrive. Sign up at mamanatural.com/updates. Also, check out the Mama Natural Baby Care course. This is a comprehensive online class that teaches you everything you need to know about navigating life with a newborn. Learn more at mamanaturalbaby.com. Hand, foot, and mouth. As if rashes weren't confusing enough, this disease has a super confusing name. Hand, foot, and mouth isn't the same as foot and mouth disease. That disease affects livestock only. Hand, foot, and mouth is the same thing as cook-saki virus. Cook-saki, New York was the hometown of the very first person to have this disease. What a way to be known. Here's another confusing fact. The virus that causes hand, foot, and mouth disease is in the same group of viruses as polio, but this is not polio. Okay, now that we've covered what cook-saki virus is and isn't, let's talk about the signs and symptoms. Symptoms can include mouth sores, skin rash of flat red spots that may blister, fever, sore throat, and loss of appetite. But really, the telltale sign that your little one has this virus is by the blisters on their hands, feet, and inside of their mouth. Usually kids have a low-grade fever and a sore throat for a day or two before the blisters appear. Here are some photos of hand, foot, and mouth blisters, so be prepared. Okay, so if you spot the blisters on your child, how do you treat it? There isn't a cure for hand, foot, and mouth disease. This is a virus, but thankfully there are a lot of natural remedies you can try to support your child. First, you want to be sure your baby is hydrated. This is super important because the blisters in their mouth might make it hard to actually drink. So be sure you're offering them lots of water. You could try electrolyte drinks. Bone broth, coconut water is super hydrating, but you definitely don't want to do citrus drinks because that is going to burn those sores. Speaking of those mouth sores, you can help soothe that inflammation with ice cubes, ice cube chips, homemade popsicles. You even can get Greek yogurt and make little yogurt dots, but the idea is to get lots of ice to help soothe that inflammation. Your kid could try oil pulling if they're old enough. They just take a little bit of olive oil or coconut oil and they just kind of swish it around in their mouth, and it has some antimicrobial properties to it. It can help soothe that irritation. Or if your child is younger, you can just gently rub some coconut oil on those blisters. Your kid could also soak in an oatmeal bath. Google Mama Natural Oatmeal Bath to see how to make one. You could have your child eat foods high in quercetin. Quercetin is shown to reduce inflammation and block viral replication. Quercetin is found in capers, onions, apples, and elderberries. You can also make a tea with astragalus root. This is a huge anti-inflammatory root that's really good to support the immune system. Probiotics can also be helpful to help your baby fight off this virus. And for the most part, you can treat this at home. However, if you notice signs of dehydration, be sure to call your child's pediatrician. Here are a few signs to look out for. Fewer wet diapers or trips to the bathroom, dry mouth, feeling sluggish, sunken in temples or eyes, excessive thirst, muscle cramps, or nausea. Now let's talk about a really weird symptom, your baby's nails. They might fall off, as weird as this sounds, and it's completely normal. That's because the blisters damage the nail bed. Now the good news is they will grow back, but just be prepared that it can happen in some kids. Because hand, foot, and mouth disease is contagious, you can help prevent spreading this disease to others in your family. You want to be sure you're washing your hands thoroughly and frequently. You want to clean off household surfaces that are used a lot, like doorknobs, faucets, and toys, and talk to your other kids about not sharing drinks or snacks, and have good social distancing. You also can boost your family's immune system with a nutritious diet and some added supplements. Now, it's never fun to see your baby sick, but I'm telling you, just give them some extra TLC and it will pass. Thanks so much for watching this video. Be sure to subscribe to my channel and ring that bell. And head on over to mamanatural.com/updates and sign up for my free baby emails. Each week you'll get personalized message that tracks baby's development, plus you'll get natural evidence-based resources for you and baby. Finally, check out my baby care course at mamanaturalbaby.com. It features a holistic pediatrician, an IBCLC certified lactation consultant, and a community of new moms. Get all that info at mamanaturalbaby.com. Thanks again, and we'll catch you next time.